Good afternoon, everyone. I'm Jennifer Vendetti from Postpartum Support International, Connecticut. I'm the chair of the board, and I'm your moderator today. We are closing out our Lunch and Learn series. We will start back up in October. If anybody has ideas for topics or speakers, you can drop me an email and let me know your thoughts about that. And we'll be doing our planning. So we'll have Lunch and Learns October, November, December, and then we jump back in February, and we have Lunch and Learns through June. Some announcements. PSI's conference is coming up June 28th to July 2nd. So if anybody is attending the conference, please let me know so that I can compile a list of attendees and I can connect you all via email. I think that would be really fantastic to go to Kansas and know that you've got some Connecticut community with you, and then you can meet up and so forth. So we're gearing up for Climb Out of the Darkness, which is the signature awareness event that PSI holds internationally, typically on the solstice. The summer solstice, longest day of the year, is usually like the third weekend in June, but now PSI has expanded that. So some climbs are in June, and then we also have climbs happening in October. So I'm going to put in to the chat an online bulletin board that gives a little bit of information about the climbs, but the ones that are coming up are Saturday, June 17th, that's Litchfield. Saturday, June 24th, there'll be several climbs, including one that Patricia Dupree Bautista and I are doing in Waterbury. And there's others. Lower Fairfield will be June 24th. Middletown, June 24th, but Middletown also has one Sunday, June 25th. So there's different locations. And I think, Heather, for you, you're going to have the option for Mansfield. Sarah Dufresne's climb will be in June, but you can also do a climb in October with Erin Ralt, and she'll be doing hers in the Putnam area. So you've got a couple options there. Switching gears, we have board positions that will be opening January 2024. These are 3-year terms. Our board meets monthly on the second Monday of the month from 6 to 7:30 p.m. Most of the board positions, with the exception of the PSI liaison, the treasurer, member at large, are also committee positions as well. So most of the board positions are also a dual role. So you're participating in board meetings, but also in committee work as well. Let me know if you have an interest, but you will see in our newsletters, Ailish just published the June newsletter a couple days ago. If you're not receiving those, you want to go to psictchapter.com. Right on the homepage, it's to sign up for newsletters. Okay. Those come out monthly. You'll start seeing in our newsletters that we'll be talking more about open board positions. Okay. Another thing I want us to just take note of is you're going to start to see a shift in lingo. You're going to start to notice a shift from PMADs, or perinatal mood and anxiety disorders, to PMHDs, perinatal mental health disorders. Okay, I don't think it's going to be a rapid shift. Certainly would not be wrong to say PMADs, is certainly not wrong to say postpartum depression, perinatal depression, because that's often what we are speaking of. But there has been a movement in our community where conditions like postpartum psychosis, PTSD, don't fall so nicely, if you will, into depression or anxiety disorders. So there is going to be a shift to PMHDs. I just wanted us to make note of that. PSI offers their free, this is a 1.5-hour webinar on Perinatal Mental Health 101. It's Bertie Meyer. She's so awesome. She's just did a podcast for the Otis, Mother to Baby. and I want to listen to that next week. But anyway, the next 101 webinar is June 22nd, 1:30 Eastern Standard Time, and I'm going to put the registration in the chat. Those of you in Fairfield County, I think you're going to want to consider receiving communications from the Alliance Center in Stamford. That's Carolyn Kagan and Jessica Vanderplug's center. It's a perinatal holistic learning and psychotherapy center, and their communications are fantastic. And the workshops that they're doing and the activities that they have happening there are really just incredible. The HRSA Maternal Mental Health Hotline has a new number. Not to worry, the old number will still be forwarded for the next year. But just to make note, there is a new number, and I'm going to put that in the chat. And I'm also going to put in the chat a link for where you can get free materials. So anyone can click on the link and order free materials for your program. I know, Danny, you'll probably appreciate doing that. And those will come straight from HRSA. If you need even more, bulk materials, then you can contact HRSA to get bulk materials there. Okay. Anyone else have announcements? Oh, Carolyn. Hi, Carolyn. I'm just talking about the Alliance Center. And thank you, Carolyn, because you put the climb in your newsletter too, and I appreciate that so much.
Well, thank you. I appreciate the shout out. I'm sitting here quietly on mute and waving to you guys. Thank you so much for sharing about some of the resources that we have going on down here in Stamford. It's really fun to create some of these, opportunities based on what we hear from our perinatal community. So we have infant CPR coming up. We also have a pelvic floor physical therapy workshop coming up. And each month we try to put together at least one community gathering. It is really easy, as you know, to fall into these silos and to stay isolated when you're going through a difficult time in the maternal mental health space. So we at least make a commitment to do one community event a month. But this month in June, we have a few opportunities, along with we're partnering with Moms Demand Action later on this month for what we're calling Move for a Movement, where they're coming in. We're getting a chance to do some restorative yoga together to calm our nervous systems, and then talking about gun violence and what we can do as parents, not only support our families, but also to really shape this mission.
That's wonderful, Carolyn. I'm really hoping too, Danny, Chelsea was going to come today, and I really wanted to connect Chelsea with Carolyn because they're both Fairfield County, Lower Fairfield County. So Chelsea White may join us, and she's a doula and is, raising her family now in Connecticut. Her and her husband came from out of state, and so it's awesome. And we got a chance to meet at the Birth Network event that I got to see Danny at recently. Yeah. So that was cool.
Cool. If she doesn't join today, I'll look her up.
Yeah, she's I think are you on Instagram, Carolyn?
Yeah.
Yeah, she's the Christian doula.
Okay, I'll look her up.
Yeah.
Amazing. Anyone else for announcements? Okay, no other announcements. I'm going to, if you'll allow me to introduce today's speaker, Danny Freeman, who's a licensed practical nurse. She's an international board certified lactation consultant and the owner of Milkin Melanin Lactation Services, and also the founder of Paving the Way Diversity in Lactation, also known as PTW. Upon entering this field, she really saw there was a need for more diversification in the lactation workforce, and really saw the breastfeeding disparities that have been affecting Black and Brown women because of lack of education and support. And she's been dedicated to both families as well as helping to build and grow our workforce here in Connecticut. And we've been in desperate need of an initiative such as yours, Danny. So thank you so much. So you're going to talk to us today about this parallel process and the work that you're doing, doing direct clinical support to women and families, and also building our workforce so that we can be better prepared to help perinatal families. So Danny, thank you so much for being here with us.
Thank you for having me. I appreciate it. I'm going to share my screen.
Okay. And I'm going to put some links in the chat.
Yes, that'd be awesome. So it's working from the, okay. So the name of my presentation is Diversifying the Lactation Field, a Collaborative Effort. And it does take a village because this is hard work. But we'll discuss, you'll learn more about me a little bit personally, professionally, and then we'll touch on the benefits of breastfeeding. We'll go over some statistics and how we can support clients. This was almost a little geared towards like pediatricians and other support staff that would interact with the breastfeeding dyads, but you know, it can apply here as well. And then we'll discuss diversifying the lactation field. You'll learn more about Paving the Way and some of our participants. Okay, so a little bit about me. I'm a New York native. I'm from the Bronx. I've been here in Connecticut for about 5.5 years with my husband and children. I have 3 children. I breastfed all 3 of them. I had different experiences with them. And combined, I have about almost 10 years of personal breastfeeding experience. So something to be like really proud of, but I did go through a lot of challenges. I didn't have any formal support for breastfeeding education. I did take a breastfeeding class with my last child, which was a little shock to me, and that was at the WIC office. And you know, my kids are big; they're like in their teens, and then I have the little one. So when I had my older children going to WIC, I associated that with formula, and of course, like other foods and stuff, but never breastfeeding. So when I had the youngest one, and they were like, "Are you going to breastfeed?" And I'm like, "Yeah, I'm going to breastfeed." And they was like, "Okay, well, you have to take a breastfeeding class." And that was different for me because I didn't associate WIC with breastfeeding support. So, so that's a little bit of my story. But professionally, I got started in the breastfeeding, in the lactation space as a WIC breastfeeding peer counselor at Yale New Haven Hospital. And then about 6 months or 7 months in, I became certified as a certified lactation counselor. And that was with the help of DPH. They rolled out these funds for BIPOC professionals to, perinatal professionals to become CLCs. And I was one of the participants. So, and then I still at WIC. I started my private practice and then became certified in July of 2021. And then I started my nonprofit, Paving the Way. So you'll learn more about that. Well, featured here, I have to shout out my client, Dadrian, and this is her baby Journey. She gave me permission to share these photos, and this was a home visit I did almost 2 years ago now, and she's on baby number 3. So this is her second child. But yeah, she's amazing. And you'll see her later. You'll see a few more photos of her. There she is.
Danny, can I just
yes.
Can I just interrupt because it's very emotional, just seeing you with this mom, and it just evokes a lot of feelings of what every mom deserves to have, that kind of nurturing maternal support. It just makes me, and I don't know if the emotion is like the yearning, of something I didn't have or what, but it's really beautiful. And also that when you and I last saw each other, you taught me something we both had in common, which you gave it a name. I didn't know, I never called it this name. We were both closet breastfeeders
Oh,
because
yes.
we had
Yeah.
toddler and preschoolers who still wanted to breastfeed. But
Yes.
of course, socioculturally, that can be a little bit,
Yeah.
challenging.
It's frowned upon. And I would
Yeah,
just hear, just in conversations, not anyone
closet
knowing
breast.
that I was, right. Not anyone knowing that I was still breastfeeding. They would just talk about other people that they've seen. And I'm like, oh, see, this is why I don't talk about it, because you're judging.
Exactly.
So yeah,
Exactly. Exactly.
I did breastfeed my two older children for 4 years each. So,
Yeah,
and they're 4 years apart. So 8 years straight of breastfeeding, just me giving my whole self to them. But
exactly.
and this was like all of my 20s, because I had my oldest at 20. I turned 20 2 days later, and um, being a young Black mom on Medicaid, on WIC, on food stamps, all the things, um, you know, I I was not the stereotypical, like, oh, she's young, a single mom doesn't breastfeed. No, I breastfed my kids. I was exposed to it by my sister. She breastfed 5 of her 6 kids, and she's has similar stories. Single mom, young, on Medicaid or WIC or whatever, and we breastfed. And I didn't have any support, but something in me just said, I have to give my breast milk. And the older I got, the further along that I went with it, I could see the benefits.
Right.
So here we are, right? With the
Relationship. Yeah, yeah.
benefits.
Here we are. Thank
Um,
you.
so some of the benefits of breastfeeding for mom, and I like to always focus on mom first, or the parent, because we forget about ourselves. We always focus on the baby and what the baby needs. So it can help to lower the risk of certain cancers like breast cancer, ovarian cancer, cervical cancer, especially even for the female child. Those risks of certain cancers are lowered as well the longer the parent breastfeeds. And then it helps the uterus to contract back down to size faster, and it's free. Right? If free is for me, especially nowadays, with the cost of formula. I remember a can of formula being $11 when my son was born. He was born in 2004. And now a can of formula at the least is probably $35, $40. And that's the generic Infamil. But if they need something, more, um, you know, they need the special formula, oh, that can run you some pretty pennies. So it's free, and clients can burn up to 500 calories a day if they're exclusively breastfeeding. For baby, helps to provide antibodies, immune factors, especially that colostrum, that first milk, is going to help to build the baby's immune system and offer that protection. And then it triggers appropriate developmental cues, and it's easily digested. So the milk has a natural laxative to keep the baby from being constipated, um, whereas formula can sit on the stomach. It takes about 3 to 4 hours to digest, and sometimes they don't poop as often. So, uh, and then the benefits for both, it helps with releasing oxytocin, that love hormone, helps to relax both mom and baby, improves the bonding with them, especially during skin to skin, and lowers stress levels. So if the mom is having a positive breastfeeding experience, it can help to lower the risk of postpartum depression, um, which is something I like to highlight. I see a lot of moms, they have anxiety, depression, they're on meds. So we want to try to make this as pleasant of an experience as possible. Okay, so some stats, because you have to have the numbers. um, so in the US, only about 69% of Black mothers ever start breastfeeding, compared to 86% of white mothers. And then research shows that twice as many Black babies die each year as white babies due to shorter breastfeeding duration. And it's estimated that about 90% of U.S. mothers provide, that if 90% of U.S. mothers provided only breast milk to their babies within the first 6 months, then we could possibly save 900 infants each year. And a higher percentage of Black women, about 60%, work outside of the home more than any other group of women, and are more likely to be the only source of income for their family. And this is from nationwide children's.org. So I know that a lot of the clients that I used to work with at WIC had to go back to work sooner. They didn't have as much maternity leave. They didn't have much support. If they were single parents, they had to go back to work to provide for their family. So providing them with the access to care is what is important. And even a lot of times when they're going back to work, it doesn't even matter if it's 6 weeks or 6 months. They feel like after that point, they're not going to be able to breastfeed. They have to offer a bottle. So we want to be able to put things into perspective, offer them the support and guidance that they need so that they can understand, like when they get home, they can still breastfeed. They can express their milk at work and still offer breast milk to the baby. If that's their goal, like if that's their goal, if that's what they want to do. If they say, no, after 6 months, I'm done, then I respect it. And then we just discuss, how to offer complementary foods and, supplement with formula if needed. Okay, so some ways to improve outcomes. The updated AAP guidelines, the American Academy of Pediatrics, continues to recommend exclusive breastfeeding for 6 months. And then, of course, introducing complementary foods with continued breastfeeding for up to 2 years. So their initial recommendation was up to 1 year. Now they've increased it to 2 years, along with the World Health Organization. So educating yourselves on the importance of breastfeeding, or other providers educating themselves on the importance of breastfeeding and how to manage common breastfeeding issues. So if you have the resources, which you'll see here, Zip Milk, I put that in here. That's a great resource for any lactation professional. So if you have any clients that are expecting, or if they're currently breastfeeding and facing some issues, they can go to zipmilk.org and they can find support groups. They can find WIC, if they qualify for WIC, they can register with them. There's a whole host of IBCLCs with it in different realms, like in private practice, pediatric offices, in the hospital. And then you have other lactation professionals like certified lactation counselors, certified breastfeeding specialists that are also listed there. So these are some ways that we could support families, and then also helping them to make informed decisions. I included regardless of their race, because we know that there could be some bias and all of that, but just hoping that providers, once they're aware, they can provide the same level of care to all patients, regardless of their socioeconomic status or background. Just offer the support, and this is some of the ways that we can help to improve the outcomes. Okay, so here's Dajian again with Journey. And this was probably the second home visit I did with her. So the support that would be provided are home visits, virtual visits, and office. I have an office in Hampden. So if folks are local to Hampden and they can come in the office, they can see us. I do virtuals and offer home visits. And I am bringing on some additional folks to help me out with the grant portion of my business. And so we assist with latching, engorgement. I do weighted feeds. So I weigh the baby before the feed. I assess the latch, make any adjustments, and then we'll weigh the baby after the feed to see how much milk the baby has transferred. And then I offer a care plan. So it could look like supplement with this amount or breastfeed this amount of times a day. I send them handouts, links, how to properly prepare formula is so important, because a lot of times they're preparing it incorrectly, and we don't want the babies to get sick or anything. I also send a pediatric report to the baby's pediatrician, and then I make referrals to any other specialist as needed. So if the baby has like neck tension, or like not open and wide enough, they may have some tension in the jaw. I may refer the baby to a chiropractor or a physical therapist. If the baby is has a lip tie or a tongue tie, then I will refer the baby to a pediatric dentist or an ENT. So we use everybody on the team. And then, of course, if they have any, if they're not feeling well, I do at each appointment, I do send out a postpartum depression screening. So even if their numbers are low, I still ask them, like, how are they feeling? How are you feeling? How are things going? How are you handling? Do they have a therapist? Or do they feel like they're in need of services? And then, or especially if it's high, we're gonna talk about that. So I will offer resources and some support groups and such to kind of help them with that, so they feel like they have support all around, not just with breastfeeding. Okay. So, excuse me. Paving the Way, Diversity and Lactation, is the nonprofit that I created last year to eliminate racial and financial barriers in order to increase the diversity in the lactation field. So we do that through one-on-one guidance. I provide them with individual guidance and financial support. So I'll discuss the financial support in a second. But with that funding and increasing the diversity, then we're able to provide BIPOC families with culturally relevant lactation care. So we're really pushing a dial to increase the amount of people that are able to provide the support throughout the state, in order to serve the families that need it the most. And so I have a quote here from Kimberly Seals Allers. And this is not the full quote, but she says, this was, I think, might have been 2020. She said, a blatant disparity in breastfeeding leadership. Breastfeeding advocacy is white, female-led, perpetuating the common misconception that Black women don't breastfeed. And so if you go on blackbreastfeedingweek.org, you can see the full blurb there. And it just kind of, it was like, that's exactly what I wanted to say, because it is white, female-led. And IBLC is the governing body for lactation consultants. They're the ones who created the credential and the different pathways on how to obtain it. And they also have, created the exam. So I think from 2020, there's 233 IBCLCs. Now this number has increased because I know some of these women personally, but less than a handful are Black. So it's myself and two others right now, and then possibly a fourth next week. But it's very limited in the state, and it just goes and there's a lot of gatekeeping as well. So I'm a very hard-headed person by nature, and I don't let the no stop me. So I'm gonna push through regardless. But it's not for me. It's essentially for these clients to have the access to the care, because they shouldn't just have one person to choose from. And I totally understand that I may not be for everyone, I don't want to be the only one, because that can lead to burnout. So I'm working very hard to increase these numbers. And so currently the WIC program has and Hispanic Health Council employ about 10 BIPOC peer counselors. I think that number has increased. But I come from WIC as a WIC peer counselor, and I think some of them get comfortable in the role. And so I feel like that has led some of the people that are in the higher roles, the super or the manager roles, to feel like this is okay. Like, you're the higher paid, like peer counselors, and that it's okay to support the field, boots on the ground type of stuff. And no, if somebody wants to move forward with learning more about lactation or becoming a lactation consultant, that's a straight shot to IBCLC. That's the pathway that I took, pathway 1, as a peer counselor, providing direct support to families. So it should be looked at more as like a stepping stone credential versus something that you just stay in and hold on to that spot for 5 to 10 years. So yeah, I'm hoping that, whoever is, if they have the opportunity and they want to move forward in this space, then, of course I'm willing to help. So, okay. So currently, we have enrolled, we have a total of 24 participants, and there's 2 cohorts. The first cohort has 14 participants, and the second cohort has 10. So we enrolled 6 participants from the first cohort in the Black course, and the Black course is it offers 45 LSERPs, and that's like our continuing education credits. So it offers 45 LSERPs, and then they also have a peer counseling course, which offers 20 LSERPs. So we enrolled about 8 participants in their courses. And we've established a collaboration with Go Lactation Academy, and we were able to enroll 7 participants from the second cohort and get a nice discount. So that was great. And going forward, that discount stands regardless if they have any sales or not. And Dion Lowndes, she is a registered nurse and now in IBCLC. She passed her exam last fall. She took the exam in the fall and got her results in December, because it takes 12 weeks. It's a very long time. And Donette she's a WIC nutritionist in Middletown, and Michelle is my old coworker. She's a peer counselor at Yale New Haven Hospital. And so they both sat in March, and they should be getting their results next week. And so, yes, we'll be anticipating more people to come. We did receive funds from CHIFA. CHIFA is Connecticut Health and Education Finance Authorities. I always chop that name up. But we received funds for this year and for next year, and we were awarded over $100,000. So that's how we are able to provide services for free to families of color throughout the state, and then also support the participants financially on their road to IBCLC. And so we plan some future goals by the end of this year. Half of the participants from the first cohort will have sat for the exam, because we have 4 more participants sitting in September. And so they're working on their application process now. And at the end of the year, I'll open up the applications for the third cohort, and hoping to diversify it even more. Like, bringing in some men, bringing in, different backgrounds. It doesn't have to just be Black or brown women. Um, so, and then we're hoping to establish um, uh, some mentorship sites with 3 to 5 hospitals or clinics. So we currently have a contract with Griffin Hospital in Derby, and we are so close to locking in Hartford Hospital. So that's a huge one because they have the inpatient, the outpatient, they have WIC, they have a pediatric clinic. So I'm like stoked about that. And Mary Marshall Krim from Hartford Hospital has been amazing in supporting this movement. So
Wonderful.
okay, we're wrapping it up. And so here's some of the participants. This is from Dion. I didn't
see
even change.
Dion, yeah, and
Yes,
I know Bianca as well. Yeah.
Oh, you know Bianca? Yes.
I
So
do.
yes, we are rocking and rolling with everybody. So you can see that they're from various backgrounds. Donette is the one of the participants who just took her exam, and so she's awaiting her results. We have some doulas. I don't know if you know any of these young ladies. So Whitley, she's
Yeah,
in the
I know
Hartford
Whitley.
area.
Oh,
Yep.
yeah.
Shamika, she's in New Haven. Casey's all over. Danielle is between Connecticut and South Carolina now. And Taylor is in New Haven. And she's also one of my contractors. She does help a lot with providing the services from the grant.
Are these doulas part of the cohort? They're
Yeah,
working toward IBC.
Yeah, so all of these ladies that I'm going to show you here, this is the first cohort. They're over. Yep.
Wow.
So and then we have the peer counselors. So Tamar is with peer counselor. Geraldine and Michelle are my old co-workers. They're from Yale New Haven Hospital's peer counseling program. Tanisha, she was a part of Hispanic Health Council, and then she moved down south, but she's still a part of the program. And she's one of the participants. Michelle just sat in March. Geraldine and Tanisha and Nia are going to sit in September along with Taylor.
Okay.
So, yeah. So, and Nia, we call her Nia, but her name is Gordani. But she was out of TVCCA, but now she's with Yale New Haven's WIC office. So, and that's them. I wanted to share some feedback. It's a quick 1-minute video. I did hold a workshop for them back in March, and it was recorded. So they shared their feedback. They were sharing their feedback.
My name is Destiny.
How can I turn it up?
Keitra.
Hold on.
I'm here today because I'm actually a birth and postpartum doula. So I've been looking to become a lactation consultant to help my clients in the postpartum side with just breastfeeding. I got in contact with Danielle and she invited me here today.
And I'm a family nurse practitioner, so I work in primary care, and I'm hoping to become a lactation consultant to be able to help the mothers that I serve and also the kids to increase breastfeeding rates, particularly in the community settings that I work in. And so I've connected with Danielle over the past year and a half and so to kind of learn more about the services she's offering and how access training. Today was really informative. I think it's always good to kind of take a step back and hear about how she's providing services in the community and learn more about different aspects of lactation support that we would be expected to offer as lactation consultants in the future.
Wow.
Okay, so that's some feedback from the participants. That was from our first workshop.
My name is
and I put some resources here for you guys. Of course, the Breastfeeding Coalition, I'm on the board of the Breastfeeding Coalition. So we always we have like SERP opportunities. Erin, who is on the call today, and Taylor Smith are going to be co-chairs. So Monica's going to be stepping back as past chair. And they're going to be co-chairing. So we'll keep you posted with the new membership meeting. And so the Melanated Mammary Atlas is a great way to, I thought this was awesome. It's an awesome resource because it offers a perspective of different conditions on Black and brown breasts. And I believe there's babies in there as well, to kind of be able to see different conditions on what it looks like on Black and brown folks. And that was created by Nikisha Killings. She is an IBCLC, but focused more on public. She has a master's in public health. So I don't know if she does so much clinical work, but she does a lot of speaking engagements and such. Of course, ILCA, you got USLCA, the US Breastfeeding Committee, and Zip Milk. If you don't know a lactation consultant, this is what you give your clients. Just give them Zip Milk, and they can find a lactation consultant or a lactation specialist or a breastfeeding support group in their area or virtually. They'd have all the resources there. And then Gold Learning, they also offer LSERPs as a way to get more educated in regards to breastfeeding. And that's my contact info. And that is the end of the presentation. I put Paving the Way first, of course. If you know anyone of, like a marginalized background, they can reach out to me directly via my cell to learn more about Paving the Way. And here's the email, web address, you can check us out. Finally got a website. And my Instagram.
I saw the website. It's fantastic.
Thank you. And Milkin Melanin lactation services for all of, any other lactation services. So in-home, office, virtual support. I'm in network with Aetna. I do accept some PPO plans through the Lactation Network, and that will be all listed on the flyer that Jen is going to send out.
Yeah,
tomorrow.
I'm going to send that out tomorrow with the wrap up. This is such an incredible movement that you've started, Danny. It's just really incredible. And for those of us who've been around maternal child health for a few decades.
Oh, yeah.
This, again, really brings tears to my eyes because it really has been a long time coming. And I just really appreciate everything that you're doing. I have so many questions. I have so many questions.
Yes,
and you all may have questions too. So we have some time, which is great. I first want to jump to Heather's question. Heather was really tuned in, I think, if I can speak for you, Heather, thinking about what the impact of breastfeeding can mean for a baby's survivability. I think that's what was really connecting with Heather there. So thinking about potentially 900 babies surviving the first year of life, right? So we know the first year of life is a vulnerable time. We know that there's a number of risks, right, for babies. And so there's different behaviors, keeping babies on their back and things like that. But why is it that for Black babies, and particularly boy babies, why are the infant mortality rates much higher, and how could breastfeeding impact that? So I just took a stab from my past work with FEMUR, which we don't have in Connecticut any longer, but that's an ACOG program. It's a very strong program in other states. And I was thinking from the perspective of preterm birth, so prematurity, low birth weight, and how breast milk could enhance the health of the baby and thus be a protective factor against infant mortality in the first year. But I just want to throw this back to you, Danny, and anybody who wants to say more about why breastfeeding could potentially save babies' lives if it were instituted, if it was sociocultural norm and everybody had the support and the education that they needed, and everybody was breastfeeding, how could that potentially lead to lower infant mortality rates?
You're asking me.
Anybody,
Oh,
yeah.
anybody? Yeah. I think it's more so that they're in their like almost like survival mode when they're breastfeeding. They're gonna naturally like wake up more frequently to feed and all of that type of stuff versus if they're getting formula and it's kind of just sitting on their stomach, or even those premature babies getting formula versus breast milk or even donor milk.
Yeah.
It's by Erin. Um, it's it can I don't know if I'm sure you guys heard of like necrotizing enterocolitis, where it eats away at the intestines because they have a mature immune system. They don't have, they haven't gotten, when they're born, they have no protection. But then if you have those preemie babies that really, really are like they need the breast milk to build up those antibodies and provide that protection, it just kind of eats away at the lining. And you know we're 9 times more likely to be offered formula than white families.
Yeah.
It's a systemic thing. Sorry. But that's what it is.
Right.
It's a system.
Right.
This like historically we have been you know um like oppressed and so
Yeah.
yeah.
And I like what you said too about what breastfeeding does in terms of triggering the innate behaviors of the newborn, and how, we know that breastfed babies, they're like you said, they're going to wake more frequently because the breast milk is so much more digestible. And we know that's the big risk, right? In the first year of life for a baby, right? And babies can sometimes, they need some triggers to breathe,
Wake up.
right?
Yeah.
They can to wake up. And so if they're being fed with breast milk, it's already going to be a natural trigger for them to wake more frequently. Yeah.
Right.
So it's a protective factor. Yeah. Yeah.
Yeah.
Yeah. That's really important. I also wanted to, anything else? That was a great question.
Did you guys have any questions?
Protecting infant mortality. Yeah. I wanted to ask about your clinic, Danny, because in my head, I know it's located in New Haven, so I think about New Haven. But you're saying that now, as you're bringing in more consultants, you can branch out. So it's not just New Haven or New Haven area. Is that true?
Yeah. Yeah. So we're serving the whole state. I'm bringing in the cavalry because I need the support. Like I can't be all over the state, and I don't. I love home visits, but my body says no. Being in the car for an hour either way is like too much.
Yeah.
So,
Yeah.
so I have um some of these candidates have other lactation certifications. So like Taylor, she's a CLC. So she's been helping me. She was the first person that I was like, come please help me. And then I have another young lady who just got her CBS. She's a certified breastfeeding specialist. She's in the Bridgeport area. So like if I have somebody in Norwalk or even like Danbury, she can get there quicker than I can. And then I have another special person who I'm not going to name, but she is going to be helping me as well. So right now I have 3 people, maybe 2 more with this, with when the results come in. And Donette is in West Hartford. So if she can cover like
Oh.
Hartford, Manchester, I would not have to touch that area. Even like Bloomfield, that would be amazing. Like, so trying to outsource as much as I can so that I don't burn out is the goal.
Yeah, that's really
Yeah.
important. Because you're our fearless leader. So we need to keep you healthy
Yeah.
and strong and
Yeah,
supported.
and the and they're getting the training to be able to they're getting the training so that they can kind of be the butterfly that they can be and go do all the things. And however, if we work together, great. If we don't, it's okay. Like, I'm like, just, we got the numbers. Like, that's what I want, to increase the numbers so that families can have options. Like, it's about them and their experience. Like, my time has passed. So it's like, it's about you. What do you want? Look, here's a list. Talk to them, see if who you connect with, and there you go. I mean, there's so many options. Like, if you go into psychology today, I can go through, it's like a whole Rolodex.
Exactly.
But when you go to look for a Black lactation consultant, it's a desert.
Yeah.
So
that's right. That's right. And really, though, on the psychotherapy side, I mean,
yeah.
Carolyn can attest to this. We are still building our BIPOC clinician community in perinatal mood and anxiety. Well, let me use the new language: perinatal mental health disorders. So, but you're right, though, in terms of the psychotherapy workforce in general, that has been built and
Oh
is
yeah.
now, we've got, but you're right. So in general, yeah, it's true.
I wanted to answer Heather's question. Let me go to the chat. So she asks, does insurance only cover lactation consultation after period, or is it private pay? So I'm in network with Aetna. Aetna will cover prenatal and postpartum visits. And it just depends on the client's plan. So sometimes they won't cover virtual, and sometimes they won't cover home visits. So, or there's a copay associated or something like that. Then there's other like PPO plans that the Lactation Network has contracted with. So Cigna, Blue Cross Blue Shield, Humana, where through Lactation Network, I can accept those plans, and then Lactation Network pays me directly. And then I'm also a network with TRICARE. So TRICARE have rolled out, I think the top of last year, like a 5-year plan for lactation professionals and doulas. So they cover the cost of that for any TRICARE participants. So, all right. Nice to see you, Carolyn.
I was going to ask you about that too, Danielle, and it's right really in line with what your question is, Heather. I wanted to know if you had an update on where we are with Husky. So my understanding is that the issue with Husky is that we don't have IBCLC reimbursement for private practice. IBCLC is because you have to be an RN. That was my understanding. But that they're looking to change like scope of practice. Is that what they would have to change? Like, so what is the holdup? Can you help us understand the Husky reimbursement barrier?
So the Husky reimbursement barrier was more so because you have to be a physician.
Oh, physician.
Right. So like, if you're in a pediatric office, there's physicians there, right? And you can bill under them for lactation services. So there's sometimes that people do that, like private practice lactation consultants will go in and contract with a pediatrician's office and do incident to bill. So they would bill under the pediatrician, or even like an OB or OB, they can bill under the OB for lactation services. And then they figure out whatever kind of split, like a 60-40 split or whatever, they can work that out. if I am a standalone, well, I'm an LPN, but I'm a standalone lactation consultant. I don't have like an advanced medical certification or anything like that. So I'm on the hustle and grind of things. Like first thing, as soon as I got certified, I contracted with Lactation Network, and that offered me the opportunity to accept some PPO plans, and then I did my application with Aetna so that I could be able to accept Aetna. And then I feel like that was like it opened up the floodgates almost. And so like I get a lot of Aetna clients because they either call in their insurance to see who is in the area that accepts it, or they go in their portal and then they find me. Right. So with TRICARE, I only have one TRICARE client, and same TRICARE client from last year because now she's had another baby. I don't really know. I don't think I'm near like a base or anything like that. And so I would build TRICARE directly because I'm directly in network. I would build Aetna directly because I'm directly in. But those PPO plans, the Lactation Network, they will build, and then I just forward my chart. If I submit my chart by a certain time, I get paid the next week. So
when I think about the issue, though, broadly speaking, I think about it related to accessing maternal mental health treatment. Mm-hmm. Insurance, it's just different issues between psychotherapy and lactation consultation.
Oh, right, because y'all have a license, right?
Well, what I was going to say is the biggest barrier to accessing treatment and care, whether it's psychotherapy on the PMHD side or lactation side, is in fact insurance. And let's just be clear about that. It is insurance. However, on the psychotherapy side, Husky is not the barrier. It's the privates that are the barrier. The privates have co-pays. The privates have thousands of dollars in deductibles that moms are up against, right? So it makes it harder to find psychotherapy treatment for the privates. Now, the privates on the lactation side are paying more. Yeah. They're paying, they're reimbursing. They have plans specific for lactation. But Husky is the barrier. And that is, so I assume though that there is some advocates out there working on this very issue. Yeah. And I think part of it though is that you acknowledge there's only about 233 IBCLCs in the state of Connecticut. Now, I'm going to assume most of those work in hospitals, so they're not in private practice. If they were in private practice, if 233 were in private practice, you have a little bit more kind of power and like incentive. But up in my area here, Hartford County, I'm in Farmington right now. We have Susan Forrester. She's been a private practice IBCLC for 35 years. But she's kind of been on an island. So there isn't like enough of you all to say, this is ridiculous. We get calls every day from moms and families with Husky insurance, and we can't access a lactation consultant. Like, this is wrong.
Yeah, I think it's the licensure. So that's what it. I should have. Yeah. So we don't have a licensure here in Connecticut. There's a few states that have it, where now they can access. They can get in, essentially get a network with Husky, or I mean not Husky, Medicaid, because I think that's what Connecticut calls it. But here, there's also some lactation consultants that don't want to go forward with licensure, and then there's others that do. So we all have to be on the same page. We all have to either come together and like Erin is actually one of the people helping to work with this. She has like a bill drawn up, and she's amazing. She just does all the things. And all the politics is like, okay, Erin, I got you, but I can hold down some clinical stuff. I could do some home visits. But that's essentially where we're at right now. So there is like a draft, but there's nothing been put in place to say, okay, we're going to actually roll out this licensure. Because I feel like some people may feel like, okay, well, I had to pay all this money to take the test and lose my mind for 12 weeks to wait for the results. And now I have to go and take a licensure exam, and it would apply to everyone. So it's not going to like be a choice.
Right.
So that's the thing. We just all have to kind of see what each other's concerns are regarding it. I'm fine either way.
I think
They
they
don't
should accept, I think Connecticut should accept the IBCLC as the licensure and then do what usually the state loves to do, just make you pay, right?
Yeah.
Each year you have to pay
Right.
for the Connecticut licensure, but not an additional exam, but some kind of a process where you show them, here's my credentials, here's my portfolio, blah, blah, blah. Somebody reviews it, you pay the money,
Right.
and then you get the LIBCLC state of Connecticut, and then you get a number, and then we can go forward. But
Yeah.
so if you have a mom who doesn't have insurance, or has Husky insurance, you would be able to serve her under your clinic through the grants.
Through the grant. Yep.
Yeah.
Yep. So
So
through
you
Paving the
bill
Way.
when you can, and then you use the grant money when you can't bill.
Yeah. So if I have, I just had two clients that were referred by the same lactation consultant. Lori Atkins referred two of these moms to me. And one is Spanish, one is Black, and one has like Connecticut or something, and which I don't accept. And then the other one has Husky. So we just put it under the grant, and I bill it that way, and whatever's paid out to me is to cover the services that have been paid. I mean, that have been performed for the month or the quarter or whatever the case is. So, and the coalition is helping me with that. So we applied for the grant through the Breastfeeding Coalition. They received the funds. They disperse the funds each month. Nia, she is amazing. She's the treasurer of the coalition, and she has just been like on it to make sure that the numbers match and everything's on track. So that's pretty much how we've been doing it.
It's amazing. I would love to see more of an alliance, more of a relationship between PSI Connecticut and the Connecticut Breastfeeding Coalition. We've talked about that. I've talked about that with Monica Bellier. I think it's been more that we're keeping the chapter going, and it's all volunteer, and we just haven't but I do want to see more crossover, more just supporting each other in any way. And then of course I'm going to assume that we also need a whole workforce of Spanish speaking lactation consultants in the state of Connecticut, because I can't name one actually.
So I think there's one that just moved from New York.
Okay.
But I haven't met her. And then we have Michelle. She's the peer counselor at Yale New Haven, so she's going to be getting her results next week. Okay. And then also Geraldine, same office. She will be sitting in September, and they're both bilingual. Great. So, and Bethany, she's bilingual. She's like quadlingual.
Bethany Soldera.
Yeah.
Soldera, okay. At Hispanic Health Council.
Yeah, I think she left there, and now she's working at Manchester, per diem. Yeah, that's where I actually met her, because I worked there for a little bit.
Wonderful.
Yeah.
This is an amazing workforce, and you're at the helm, and I love also your approach to leadership, Danny, is a relationship-based approach. It's a very much a woman's approach. It's a feminist approach. And I appreciate you so very much for being speaker today for the PSI Lunch and Learn.
Yes, thank you for having me.
Really an honor to have you. Thanks so much for the work you're doing. I have so many more questions, but I will let you go. And thank you, everyone who was able to be here, and I know many more will be listening to us in the recording, so thank you. And it looks like Heather was asking, and I can follow up with Heather, is there funding available for those that need services but are not covered through insurance? I guess what I would answer is we have the Hispanic Health Council, Heritage and Pride, and then your clinic. I mean, those are the only two sources, or hospitals will typically, at least I know here at UConn, if you birthed here, you can come back and see Marissa outpatient, and
Yeah.
there's no fees charged. Some hospitals do have a fee. I think Manchester had like a, but
30.
they probably waive that if you don't have the funds to pay for that. But the funding part is a barrier. It's a
Yeah.
barrier.
And that's what I offered. I'm still technically offering like free clinic Fridays, and that's open to the public. And that's every second and fourth Friday. Where, if they're not sure if they want to book a full consult, they can come. I assess the latch, I do a weighted feed, and then usually 9 times out of 10, they book an appointment because I'm not giving them like an official care plan or anything like that. I say, hey, we can go over this. I could do a flange fitting. I could do, all the things, do an oral assessment in baby's mouth. And then, they usually schedule an appointment for the following week. So,
That's great.
Yeah.
You're busy.
Yeah. Yeah. That's why